Large male breasts that look like female breasts are a common concern to men of all ages. This is called gynecomastia, and men often tell me they're so self-conscious that they're too embarrassed to take their shirts off at the beach. This often runs in families, is associated with obesity, and is occasionally caused by hormones, but in most cases it happens for no reason. The enlargement of the breast is from either just excessive fatty tissue or excessive fibrous glandular breast tissue, or a combination of both. In this photo, you can see the physical issues that are associated with man boobs. There is significant enlargement of size and also sagging and drooping of the breasts. After breast reduction, the breast size is significantly smaller and the chest is flattened so one can see the shape of the chest wall. Male breast reduction is suitable for anyone with large breasts, any age from 15 to 75, whether it's genetic, hormonal or weight-induced. The combined liposuction method is ideal if someone wishes to avoid long scars. It's not suitable for someone who's prepubescent. A large part of breast tissue is actually fat, so the size can be reduced by just removing fat. Breast reduction using tumescent liposuction is a technique that uses 1 or 2 small incisions to remove the breast fat. A small incision is made in the skin through which a large volume of a very dilute local anesthetic is injected into the area. A microcannula is used to create many fat suction tunnels and remove the fat. Immediately after the procedure, the tunnels close and this causes skin retraction. Full results can take a few weeks or months. About half of the people just need the tumescent liposculpture. The other 50% first have the liposculpture and then a small incision along the lower edge of the nipple to remove the gland. The gland can be the size of a pea or the size of half a tennis ball. By first performing liposculpture, we can keep the scar quite small for the surgical removal component. After surgery, a specifically designed compression garment is worn for 2 weeks and then part of the time for another 2 weeks. Most men can return to work in a couple of days, but exercise and heavy work is not recommended for 2 weeks. The results can be evident as soon as the swelling goes down. Generally, there's a quick recovery time, reduced or very little scarring. Tumescent liposuction means less risk of bleeding and infection. The results are dramatic, and the patient can expect the chest to be totally flat. Most patients can keep the surgery secret, and it can be combined with high-definition liposculpture for highlighting the pecs on the side of the chest. Like all surgery, this procedure carries risks of infection, swelling and bruising. There can be tenderness or even pain. Rarely the nipple can be dented and leave a more obvious scar. Wounds ooze fluid for 24 hours. Results do vary depending on the initial size and shape. The tumescent liposuction method has made this an extremely popular procedure, as there's little downtime and a patient can hope for a totally flat chest. Attention must be given to understand if the breast enlargement is from fat or gland tissue or both. The procedure often has significant effect on a man's life, both physically and mentally, as they'll feel better about themselves and be more inclined to take the shirt off when they go to the beach.